Hand, foot, and mouth disease is a very common virus spread among children that are between the ages of 1 and 4 because it's spread through like saliva, nasal secretions, and also feces. And so children of this age aren't really able to control all of those things very well. And if the virus in those contaminants gets on a surface and someone else touches them and puts it in their mouth, then they get sick too. It can make the child feel like they have the flu. They may run a fever, just act lethargic. A small child that's not able to communicate to you may just stop eating and drinking well because they have blisters in their mouth that hurt. You may start to notice a rash. They get it in their mouth, on their hands, their feet, and sometimes their buttocks and their thighs. It usually lasts for about 7 to 10 days, and the child is most contagious during the first week of infection, but they can actually pass it for weeks to come. So it's important to take precautions if your child has had this. The best way to defend against it is hand washing. Wash your hands and your children's hands frequently with warm water and soap. Use an alcohol-based hand sanitizer when you're out and about, and decontaminate commonly touched surfaces in your home, especially if someone in your home has had it. If you know that there's been some type of infection at your child's daycare or preschool, then talk with the administrators there about what precautions are being taken to prevent the spread of illness. Hand, foot, and mouth disease is not concerning. It's not going to have long-lasting effects. It's, of course, inconvenient and uncomfortable for the child that has it, but it will pass. These symptoms associated with hand, foot, and mouth are also associated with many other illnesses, though, some of which require treatment. So if you haven't actually had a diagnosis of hand, foot, and mouth disease, talk with your pediatrician. They'll make sure that that's what it is and talk to you about how you can support your child through it. Like they'll recommend over-the-counter pain medications to reduce fever and help them with pain and discomfort. They'll talk to you about keeping your child well hydrated. This is a big concern because if they have a sore throat, they're less likely to drink, and this is what can become a problem as a result of hand, foot, and mouth disease. Encourage things like cold juices, popsicles, ice cream. Those are welcome treats for kids, and it will actually soothe those sores and blisters in their mouth. If you haven't gotten a sure diagnosis and your child's rash seems to be spreading, if they're running an unusually high fever or it's persisting, if they're showing signs of dehydration, then call your pediatrician. And after asking you more specific questions and checking your child out, they'll decide if further investigation or treatment is warranted. If you have more questions for me in the future, please feel free to ask them on our Facebook page at facebook.com/Intermountain Moms and recommend us to your friends and family too.